Treatments for parasomnias. 1. Sleepwalking. Sleepwalking in itself isn't harmful, but does put people at risk for getting hurt accidentally and can sometimes be caused by underlying health conditions that can affect your sleep. If you or a family member sleepwalks once or twice, it probably isn't a big deal. But if sleepwalking becomes a regular thing, consider bringing it up with your doctor. While there's no formal diagnosis for sleepwalking itself, he or she may want to run tests to look for hidden conditions. 2. Sleep talking. There's no known treatment for sleep talking, but a sleep expert or a sleep center may be able to help you manage your condition. A sleep expert can also help to make sure your body is getting the adequate rest at night that it needs. If you have a partner who's bothered by your sleep talking, it might also be helpful to talk to a professional about how to manage both of your sleep needs. Some things you may want to try are sleeping in different beds or rooms, having your partner wear earplugs, using a white noise machine in your room to drown out any talking. Lifestyle changes such as the following may also help control your sleep talking: avoiding drinking alcohol, avoiding heavy meals close to bedtime, setting up a regular sleep schedule with nighttime rituals to coax your brain into sleep. 3. Groaning. Sleep groaning is also called cataphrenia, causes you to groan vocally while you sleep. Sleep-related groaning is a long-lasting disorder that often occurs nightly. The following tips on how to get a good night's sleep: follow a consistent bedtime routine. Establish a relaxing setting at bedtime. Get a full night's sleep every night. Avoid foods or drinks that contain caffeine, as well as any medicine that has a stimulant, prior to bedtime. Do not go to bed hungry, but don't eat a big meal before bedtime either. Avoid any rigorous exercise within 6 hours of your bedtime. Make your bedroom quiet, dark and a little bit cool. Get up at the same time every morning. 4. Nightmares. Treatment for nightmares isn't usually necessary. However, treatment may be needed if the nightmares are causing you distress or sleep disturbance and interfering with your daytime functioning. The cause of the nightmare disorder helps determine treatment. Treatment options may include medical treatment. If the nightmares are associated with an underlying medical condition, treatment is aimed at the underlying problem. Stress or anxiety treatment. If a mental health condition, such as stress or anxiety, seems to be contributing to the nightmares, your doctor may suggest stress reduction techniques, counseling or therapy with a mental health professional. Imagery rehearsal therapy. This involves changing the ending to your remembered nightmare while awake so that it's no longer threatening. You then rehearse the new ending in your mind. Medication. It is rarely used to treat nightmares. However, medication may be recommended for severe nightmares associated with PTSD. 5. Bedwetting. Treating bedwetting isn't an exact science. Since it's very common until 6 years of age, we generally don't try to treat it earlier. Many young children and their parents are better served by reassurance that there's no physical abnormality than by long-term and expensive therapy of uncertain effectiveness. 6. Teeth grinding or jaw clenching. Clenching or grinding your teeth occasionally is normal and typically won't cause damage, but when done regularly, it can harm your teeth and cause other oral health issues. Grinding typically occurs during sleep, so it can be hard for people to know whether they have bruxism. Signs include a sore jaw or constant headache, and a partner can sometimes hear the grinding. Your dentist can also look for symptoms, like changes or abnormalities in your teeth as well as jaw tenderness. These strategies will help you stop grinding. Wear a night guard. Though night guard won't stop you from grinding, it protects your teeth. Exercise. Whether you opt for a major sweat session or just a stroll, working out helps alleviate stress, which is a common cause of bruxism. Take a warm bath before bed. Warm water can help relax your jaw muscles right before you turn in. Relax, since anxiety is a major force behind grinding. Try to unwind and relieve stress just before bedtime. Learn new habits. Seek help. If you suffer from severe anxiety, talk therapy with a psychologist or psychiatrist may help alleviate that, which in turn will reduce grinding. Avoid alcohol and caffeine. Grinding may get worse after drinking alcohol or caffeine. So skip that glass of wine or cup of coffee in the evening. Don't chew anything besides food. Gnawing on pens or pencils or similarly hard items can enable your jaw muscles to get used to clenching, making you more likely to grind your teeth. Skip chewy foods. Keep gum, steak, popcorn, and other chewy foods to a minimum when you've been grinding your teeth. This will ease soreness and give your jaw a break. Thanks for watching. Like this video. Share and comments, subscribe now for new videos and update.